Here we are. I undertook a quality improvement project through the Cardiff University clinical diploma, and the title of my quality improvement project was Reducing the Carbon Footprint Associated with Inhaler Prescribing in Swansea Bay University Health Board's Primary Care Sector. And like mentioned, I undertook this while I was working with the Swansea Bay University Medicines Management team, which is a pharmacy-based team that provides support to primary care practitioners to try and optimise prescribing. So, let's go to the next slide. So for some context, I'm just going to begin with the background that I found useful and the kind of documents that I looked at to try and decide what QI project I wanted to undertake. So as we all know, and we've discussed today, that we're facing a climate crisis that the NHS urgently needs to rise to. So in recent years, the NHS has published several documents in response to this climate emergency. So the first document I focused on was delivering a net zero national health service. And this set out plans for the NHS to support a decarbonisation agenda. So the carbon footprint that the NHS directly controls, for example, prescribing decision, the ambitious target of net zero by 2040 was initially set. And this document highlighted that the largest primary care carbon footprint was associated with inhaler prescribing in primary care. So to support the NHS Wales in achieving the move towards net zero emissions, the document NHS Wales Decarbonisation Strategic Delivery Plan set out a number of initiatives in building, transport, procurement and healthcare. And this QI project focused on supporting initiative number 43 of this plan, which was transitioning the existing use and distribution of carbon intensive high global warming potential inhalers to those with lower global warming potential where appropriate. And then the final document that was a key factor in this QI project was the All Wales Asthma Adult Management and Prescribing Guidelines that went out for consultation when we were first looking at undertaking this QI project around August of 2021. And then were later published then in December of 2021. And this document saw a shift, like it did in the COPD guidelines as well, in the recommendations surrounding device selection to support these NHS initiatives that we had seen coming through. So dry powder inhalers are recommended preferentially unless otherwise contraindicated due to their significantly lower global warming potential, as they do not contain HFA propellants. So like we all understand, carbon footprint associated with inhalers is linked to the HFAs used in the propellants of MDIs, and how they have since been identified as greenhouse gases with very high global warming potential. So on this slide, I've included the driver diagram that we made within the medicines management team at the time of undertaking the QI project. So we tried to scope out what kind of avenues we could go down within primary care to try and reduce the carbon footprint associated with inhaler device prescribing. And so, like Oliver mentioned, one branch of it was the appropriate inhaler disposal, which they are looking at now in medicines management. But the other branch was prescribing of inhalers containing a lower global warming potential. So the pathway I've highlighted in green was the initial plan we decided to undertake. So we decided to focus on moving from the carbon intensive MDIs to less carbon intensive MDIs as the between prescribers and between prescribers and patients without creating additional workload for the GPs at the time. So at the time we undertook the project, the GPs were facing significant demands as we were coming towards the Christmas period and the COVID peaked again. So we wanted to keep the impact of the switches low on the GP. So on this slide is more scoping before we undertook the project. So the prescribing of MDI inhalers was assessed in Swansea Bay University Health Board through primary care prescribing data. And we worked out overall environmental harm of inhalers by considering two factors. So first being the volume of the items being prescribed in Swansea Bay, and then second being the indicative carbon footprint per inhaler, to give a better picture of what impact each inhaler was having. So the first step towards decarbonisation, as we discussed in the driver diagram, was moving from high global warming potential MDIs to lower global warming potential MDIs. And just on the screen here, you can see there's two switches that we decided to start with. So we decided to focus on a SABA switch, so Ventolin Evohaler to Salamol MDI. We've contained the indicative carbon footprints here as well and the cost impact. And the second switch we've decided to do was Flutiform to Lufrabec MDI, and this is the 2 puffs BD to 2 puffs BD. We since had feedback on this switch and haven't taken it as far as we took the Ventolin switch, but I'll discuss that in a little bit. Okay, so ScriptSwitch was utilised to deploy these switches that we had narrowed down. So for those of you who might not have seen ScriptSwitch before, I've included our first message that we deployed for Ventolin. So ScriptSwitch is a software that's embedded into the GP's own computer system. It's controlled by Swansea Bay University Health Board's medicines management team and displays various messages when a drug is prescribed by GP. So traditionally it's been used for cost-saving switches, to offer a more cost-effective medicine in place of one that was about to be prescribed, or even linked to MHRA warnings or drug shortages. But this is the first time we've used it to support the decarbonisation agenda. So this switch could be accepted by the GP, and then it will populate the prescription with Salamol instead of Ventolin, or likewise rejected, and they would be allowed then to continue prescribing the Ventolin. So these ScriptSwitch acceptance rates would be our instant quantifiable data for our QI project, as prescribing data in primary care has a 2-month delay. So therefore we deployed these simple messages without any educational support and considered this our baseline period. So we went on to support and improve these ScriptSwitch messages, but this is how we got our first initial data. So for PDSA Cycle 1, we had been able to identify in scoping that the biggest barrier to supporting inhaler decarbonisation agenda was lack of resources to be able to identify which inhalers are high global warming potentials inhalers. And with an easy to read resource that categorised the inhalers into a traffic light system, it was thought that this could be used as a quick reference guide to prescribing. So I'll show the one-page document that we developed on the next slide, but we titled it Carbon Footprint Comparison of Asthma Inhaler Therapies. And we collated all of the inhalers that AWMSG had recommended in their asthma guidelines into different categories. And then this document was then taken to the GP leads for Swansea Bay and also Swansea Bay's practice pharmacists through 2 meetings. So our primary care prescribing advisory group and then our practice pharmacist group meeting. So the document was shared there and then sent through these email trails to be hopefully used in practice and spark conversation and try and help the understanding behind why we had deployed these ScriptSwitch messages as well. And we also discussed the ScriptSwitch messages in these meetings to try and highlight that this was the work we were undertaking. So this is the one-page document we developed and shared through these groups. So it categorises the inhalers into a traffic light system. So green being low carbon footprint and the first line where appropriate, and then moderate carbon footprints where DPIs aren't appropriate, and high carbon footprints that we should be trying to avoid. So that included Ventolin Evohaler, Flutiform MDI and Symbicort MDI where possible. And just a little bit of information as well then for the primary care prescribers to get some background. So this is the PDSA Cycle 1 message that we developed. So we'd had feedback to say that some of the GPs and primary care prescribers hadn't recognised that this was an environmental switch. So prior to undertaking this project, the medicines management team had done extensive cost-saving switches for inhalers. And so it was being missed by some prescribers that it was for an environmental reason and not a cost-saving reason, because as you can see on the slide there, only 4p difference. So really we were trying to drive the message that this was for the carbon footprint saving. So we just highlighted that in red to try and make it stand out a bit more. And then for PDSA Cycle 2, we ramped up these messages even further with more information to aid understanding and standardise access to this one-page document that we had developed. So we uploaded the one-page document onto our Swansea Bay intranet and then hyperlinked it into the message so that it could be accessed at the point of prescribing and was more widely available for all prescribers if they hadn't been included in this email trail or the poster hadn't been disseminated. And then we also put some more information obviously on the ScriptSwitch message. So as you can see here, we put our final version of the ScriptSwitch message. We put into context the switch through a car journey. So Salamol would be approximately equivalent to driving from Swansea to Chepstow, whereas a Ventolin Evohaler would be Swansea to Southampton. So we thought this would, spark conversation not only between prescribers, but be a starting point for a conversation between prescribers and patients as well, while this flashed up potentially when they were in their reviews and things like that. And then at the bottom then you can see the hyperlink to the one-page document for people to access as well. Okay, so just to go on to results quickly. So I'm going to focus on Ventolin as we decided not to take the fluticasone message forward. We had feedback from secondary care that in Swansea Bay, fluticasone MDI was used as a last line, and so this would often be people who weren't optimized on other inhalers, and so they requested that if secondary care had started fluticasone MDI, that they not be switched back to Lufferbeck in primary care. So we've since amended our message to try and reflect this more, and I think we're going to support these kind of switches through different means rather than ScriptSwitch. So we saw good success with Ventolin. I think that's owing to the fact that Ventolin and Salamol are direct equivalents to each other. So the number of switches being accepted out of the total offered was collected daily through ScriptSwitch, and success was seen here when we look at the run chart. So from a run from baseline up to PDSA cycle 1, we saw the median increase by 15.9%. So the improvement was then maintained through PDSA cycles. So for October of 2021, to put it into context, Swansea Bay's ScriptSwitch sees an average of 42% roughly acceptance rates, and this is for all messages, not just the ones we deployed. So to be considered a successful switch, we needed to be achieving acceptance rates really of more than 50%, which we did see once we'd implemented PDSA cycles 1 and 2. We saw, the jump from roughly 35% to up and above 50%. So it was a successful switch. We considered it to be successful. So we then looked at prescribing data when that came back with the 2-month delay. So these two pie charts here show salbutamol items for July 21, which was pre-QI period, and then December 2021 when the QI period was wrapping up. And the prescribing data showed a decrease of 11% for Ventolin Evohaler as a proportion of all salbutamol prescribed. So it's going in the right direction, and this will, continue to increase as the ScriptSwitch messages are kept live, and they're still running to this day. So to conclude, there are many areas for further work, and ScriptSwitch isn't appropriate for all inhalers, but it's definitely been a really successful one for Ventolin to Salamol. And this project is proof that with the right information and support, decarbonisation is an area of work where achievements can be made. So considering the implementation of ScriptSwitch for Ventolin Evohaler in Swansea Bay locality from October to December 2021, we saw a carbon footprint saving there at the bottom of 67,000 kilograms of CO2 equivalent, which is roughly equivalent to driving 1,112 return trips from Swansea to London. So it really puts it into perspective what this simple switch can do. Okay, thank you for listening.